The medical technology firm Angle has just reported some very encouraging results from one of its collaborative partners using Angle's Parsortix technology, which basically filters out cells for early detection of cancers. And this is raising the very real possibility that there could soon be a very simple and effective blood test to detect cancers far earlier than can be done at the moment. Well, we're joined now by the CEO of Angle, Andrew Newland. This is the University of Vienna, who have done all the exciting research using your technology. It seems to be a fairly major breakthrough.
Good morning, Nigel. Well, we're extremely excited about this major breakthrough. The Medical University of Vienna have published today at the big cancer conference, AACR, taking place in Philadelphia, results which substantiate the early results which were produced in January in relation to ovarian cancer, and have they've undertaken research with 65 patients now, 42 cancer patients and 23 healthy normal volunteers. And what they found is, with the first set of analyses they did, which was with 7 RNA markers, they have got an 80% detection rate of ovarian cancer, and that compares to 24.5%, which is the best that has been achieved previously.
And of course, this means that you're going to detect it far earlier, and the earlier you detect it, the more chance there is of the patient making a recovery.
Absolutely. Ovarian cancer is known as the silent killer, and that's because it's identified very late in patients. And unfortunately, that has a very dramatic impact on their likelihood of survival. Unfortunately, if it's diagnosed late at stage 4, typically the patient has a 3.5% chance of being alive 5 years later. Whereas if it's identified in stage 1, then they've got a 90% chance of being surviving after 5 years. So it's very, very important to detect this cancer, and it's not currently possible.
Yeah. So it's a very, very significant increase in the effectiveness of this. How has that come about? How has your technology enabled this to happen?
Well, actually, it's a combination of our technology and the ability of Medical University of Vienna to identify specific RNA markers which discriminate between ovarian cancer cells and any other cells. So our Parsortix test is a simple blood test, no different from any other blood test that the patient might have. What's clever about it is we put the blood through the Parsortix system, and we manage to capture the circulating tumour cells in a very high purity. What previously no other system has had the level of purity in terms of high numbers of circulating tumour cells, but low numbers of white blood cells. And that then enables the Vienna RNA markers to be used. But what's even more incredible about this is that they've increased the number of RNA markers to 30. And on a limited subset of the population, they managed to find 100% sensitivity and specificity for ovarian cancer. That meant that every single patient who had ovarian cancer, they correctly identified through our blood test, and every single volunteer who didn't have ovarian cancer, they correctly identified as not having it. So that's 100% specificity and sensitivity. And not only has the existing diagnosis have a low sensitivity in detecting patients, but it also has a low specificity, so it incorrectly identifies false positives and tells people they've got cancer when they haven't.
Yeah. So this means that, I mean, it's some way to go, but presumably this means that there could be, in the not too distant future, a very simple blood test that would not only detect much earlier ovarian cancer, but other cancers as well.
Absolutely right. So we are full speed ahead with Medical University of Vienna and multiple other major cancer centres to basically expand the patient studies to provide enough patient data to support regulatory authorization for a test for ovarian cancer. We think that's about 18 months away. And you note there about other cancers. It was very, very exciting that Medical University of Vienna extended the work into breast cancer. And what they found was that they correctly identified 71% of breast cancer patients using the 7 markers, and that goes up to over 90% with the 30 RNA markers. So This opens not only the ovarian cancer market, which we estimate to be worth £300 million per annum to Angle, just for the specific application of ovarian cancer that we're talking about. There may well be many others. But also the breast cancer market, which is probably 3 or 4 times larger than that, over £1 billion potential revenues per annum, because obviously it's a very large number of people who suffer from breast cancer.
Yeah. And also, just worth mentioning as a footnote, that there's also another research project which you're doing with Thomas Jefferson University with single-cell breast cancers.
Yes, we've got 10 major cancer research centres working on translational research with our Parsortix system. Translational research means trying to apply it to the benefit of patients rather than early stage research. And one of them, Thomas Jefferson University, the Kimmel Cancer Center, which is a specialist breast cancer center based in Philadelphia, where I am at the moment, they made an announcement at the same AACR conference yesterday with regard to their work on breast cancer with Parsortix system. And they have proved out the ability to use the harvested cells, cancer cells from the Parsortix system for single cell analysis using a very complicated system. And that's which already exists, but the fact is that our CTCs can be analysed by this system. And the real relevance of that is that cancer is heterogeneous. All the cancer cells can be quite different. And if you can individually manipulate them, you can gain even more information about which therapy may be beneficial for that breast cancer patient. So that offers tremendous promise as well, and builds out with multiple different groups working on breast cancer.
Yeah. Okay. Well, Andrew Newland, thank you very much indeed for joining us. I think that does count as an unlikely good news story, at least going forward. Thank you very much.
Thank you very much.